Yes, good afternoon, good evening, good night, wherever you are. My colleagues in uniform, my colleagues in uniform. Yes, this is James William Mugeni, a medical clinic officer by profession, and now a certified public manager. Yes, the industrial action. 7 days counting. One could almost say 6 days counting because we have a weekend and then perhaps Monday it starts off. I have seen the nurses having their different days of the industrial action, but colleagues in uniform. When I say colleagues in uniform, I'm meaning doctors, I'm meaning nurses, I'm meaning physiotherapists, I'm meaning laboratory technologists, I'm meaning pharmacists, I'm meaning dispensers, I'm meaning occupational therapists, I'm meaning anyone, the orthopedic officers, I'm meaning every person who offers health care. If we say the allied health professionals are laying down tools, that means laboratory technologists. That means nobody will be going to the lab. That means if the clinic officers prescribe drugs, the dispensers will not be dispensing drugs. That means nursing care will not be there. So why are we continuously being divided over this? The nurses. I think the moment the industrial action by the allied health professionals kicks off, yours comes in automatically, and even the doctors the doctors come in automatically to support. I am so discouraged about my country. I'm a Ugandan. I've been in Uganda 58 years now is my age, and I lived in Uganda for 51 years. So most of America has not made me, it is Uganda that has made me. I have all the experience you can talk about healthcare in Uganda. I have been at referral hospitals, Bara University Hospital, Mulago, district hospitals, and then I own a clinic. I will tell you my own experience from my own clinic. My clients, my patients cannot pay for the services that I offer, so it is not worth running a clinic in the rural areas. And healthcare per se in America is one of the most paying professions. The nurses are very rich people in the USA. Ugandans, when you tell them about that, they tell you we are a third world country. When will health in Uganda stop being health of a third world? I have seen my MPs, I come from Busia, my MPs of Busia organizing a Muhoozi party on 22nd May. If members of parliament are organizing a Muhoozi party and you're talking about an industrial action and they don't listen, then it means we don't matter. We don't matter. Right now, the whole country will be thinking, the whole country will be worried on what to do. But can you see, after Muhoozi party in Busia, they're going to be a Muhoozi party in Tororo. So, can we help citizens? Can we help Ugandans to get their priorities right? All these mistakes that are happening in the country is because we, the health workers, took a back seat. Health rules the world. The United States, you get it wrong, you can't be a president. In our country, the health workers are non-starters simply because you took a back seat. Yes, each of us thought will benefit by sitting back, but now it is biting. There is no explanation why a Ugandan health worker should be destitute. So fellow countrymen in uniform, the health workers, if you mean it, the industrial action is changing how Ugandans will think. Just think of the Kabarole accident and there is no health worker in the hospital. And it's not your mistake. It's not your mistake. You did not train to be a pauper. You're a professional. You're supposed to get a professionally paid. 40 years of investment, 40 years of peace. There must be money in Uganda. Let's go for it. I salute you all. Thank you.